Thank you. Welcome everyone. I'm Councillor Matthew Whittington, Cabinet Member for Community Wellbeing, Health and Care. Just some safety information. See if we've got anyone in the gallery. We haven't, but if the continuous fire alarm sounds, please evacuate the room by the stairwells. Do not attempt to use the lifts. Please assemble by Queen Victoria's statue in Guildhall Square. No one would have signed in, so that's fine. There's no press or public. Please everyone use the microphones and remember to switch them off when they are finished. So I'll start with introductions to my left and work round.
Anna Martin, Democratic Services.
Richard Webb, Deputy Director of Finance.
Andy Biddle, Director of Adult Social Care.
Medwick, Councillor Medwick.
Councillor Graham Heaney, Labour Group Spokesman.
Councillor Lewis Gosling, Conservative Group Spokesman.
Thank you very much, everyone. There are no deputations today, and there are no apologies for absence. Members, do you have any declarations of interest at all? No. Okay. So we move swiftly on to agenda item number 3, Adult Social Care Fees and Charges 2024 to 2025, and over to Richard Webb and Andy Biddle. Over to you, chaps.
Thank you, Chair. So the purpose of this report is to seek approval for the proposed amendments to the annual adjustment mechanism for the fees and charges relating to services provided by Adult Social Care for the financial year 24-25. The report is also seeking approval to the proposed annual rate adjustment mechanism for future years' fees and charges. I do not intend to go through the report in detail, however I would like to highlight some of the following points for you. Firstly, the report is not seeking approval for the final fees and charges for 24-25, but rather the mechanism for calculating them. The report is seeking delegation for the Director of Adult Social Care in consultation with the Finance Manager to calculate the rates based on the agreed mechanism. Where the changes to the fees and charges for City Council clients are proposed, the amount that these clients will pay towards the cost of their care will be subject to a financial assessment, which will be completed in accordance with the Care Act and the related charging regulations. Clients will only be asked to contribute to the cost of their care based on this assessment of their assessment of affordability. Therefore, if a client is already contributing towards their cost of their care and that assessment has been calculated at the maximum assessed level that they should be contributing, these changes will not impact them. Where changes to the fees and charges relate to individuals placed by other organisations within the adult social care services included within the report, then we are seeking to ensure that the City Council is securing as close to full cost recovery from these organisations as possible. And it will be the responsibility of that funding organisation to decide, subject to any relevant Care Act responsibilities, if they have any, as to what charges they will then decide to pass on to their own clients. And lastly, the report provides more detail on the options considered and the rationale for the proposals in front of you today in more detail. But I'm happy to take any questions at this point.
Thank you, Richard. Does anyone have any questions for Richard at this point? Graham, go for it.
Just one, I did ask a question at the briefing we had about the impact on individuals, and I know you've explained that it's not about the actual charges people will get, but about the mechanism, and you did say there is discussions that go on between clients and the service about their affordability, and of course there are certain rules that they meet as well. The one question I had was in relation to the other organisations, because I understand the need for full cost recovery, but the bit that I'm not quite clear about is to what extent other organisations have the same responsibilities we do under the Care Act, and whether in fact people who are funded, who have services to other organisations that then contract with us, will be potentially disadvantaged. I'm thinking theoretically and hypothetically here, but I'm just wondering if you can enlighten me as to whether that might create some anomalies potentially for people who are getting services from us or maybe from the NHS.
Thank you, Councillor. I don't think it will. I think that the main type of organisation that contracts with the City Council, with Portsmouth for those particular services, would either be, for example, another local authority such as Hampshire County Council, or the Integrated Care Board, Hampshire and Isle of Wight Integrated Care Board, the commissioning arm of the NHS in Hampshire. So in the case of the NHS, because care in this regard would be free at the point of access, there wouldn't be any charge passed on to those individuals who are being paid for by the NHS. In relation to another local authority, that would pick up what Richard talked about in terms of Care Act responsibilities, so they would be charging, but they will be operating, I think I'm probably absolutely right in saying, a very similar mechanism to us in assessing charges to individuals. So there'll be a need to, there'll be a minimum income that the individual's left with. They'll apply their own criteria as we do for anyone who's got over the above limit of around about £23,000, and they'll have a tapering income from anyone who's got between the upper and lower limit. So I can't see, from my perspective, with my experience, that anyone would be treated anomalously to anyone that we're working with here. Richard may have thoughts.
No, actually, it's exactly as Andy's explained. The two different types of organisations are mainly the ones that would be placing clients within our in-house services, which is what's covered in this report here. And as Andy says, if it's a local authority, then they would have to follow the Care Act principles, and same as we would in considering whether they pass those charges on to their clients.
That's fine. I recognise that sometimes we don't find anomalies until after and something happens to occur. So it's obviously not the intention to create those, but that's, I think you've obviously taken, you know, as much reasonable care as you can in terms of washing that out. The other question I had was in relation to the equality assessment, because I looked at the back of it, and there's one there under health, and it says, will this help promote healthy, safe and independent living? And it says, this section is not applicable to my policy, which I thought was a bit odd, because it surely is. There is an applicability to the provision of services and charging that would apply. I mean, I'm not suggesting that we should hold up the report, but I'd be interested to know if my suggestion is that there should be something there, and possibly we could include that at some future date.
Okay, when I completed the impact assessment in relation to that question, I didn't see that this policy change would seek to adversely impact or promote those arrangements. So they're not seeking to do either. So.
Very specific about whether this will particularly impact on that rather than the more general thought of it. Yeah, okay, I understand that. Yeah, thanks.
Thank you, Graham, and thank you, Richard and Andy. Any other comments or questions? Okay, Andy, did you want to say anything additional?
Thank you, Chair. I think what we're trying to do with this report is not only comply with, as far as we can, in terms of the principle of full cost recovery that the Council subscribes to, but also enable us to balance very challenging financial circumstances, as we know, for local government and for Portsmouth City Council, but have moderate the impact of managing our finances and increasing our income. And I think from a service perspective, my confidence in managing that impact is that we do individual assessments. We make individual assessments of financial circumstances. We provide advice and support in terms of benefits take up. And we have very personalised service in Portsmouth through our colleagues in finance and through client charges. So I think from a service perspective, as well as from a finance perspective, this is probably quite a balanced way of trying to manage some of the challenging financial circumstances that we find ourselves in.
Thank you, Andy. And obviously this is inextricably linked to our, as in community wellbeing, health and care's contribution to the savings target at full council budget tomorrow. And can you just sort of put forward what impact this will have in terms of safeguarding services elsewhere in adult social care?
Yeah, certainly. So every financial year, when we identify as a council that we have a gap between the money that we have coming in and the money that we're spending, Then there is a discussion amongst all the directorates in the council around savings to be found, and each directorate has a proportion of savings against that directorate based on the spend, so a proportionate divvy up of that, if you like. So the principles that we try to pursue when we were going through those savings around each year are to maintain statutory services, but also to maintain as far as we can those services that we know will have an impact on most of our residents. So generating savings, or generating the income to offset the savings through this method, means that we don't have to look to services that we provide and generate savings from those. So I think what it would be fair to say for adult social care in the 24-25 financial year, if the budget is approved tomorrow at full council, we are contributing to corporate savings through raising fees and charges rather than through having to trim or cut back on services that we provide.
Thank you, Andy. And I think that's really at the core of our approach within community wellbeing, health and care, and certainly has been since I've been cabinet member, apart from my year out, of course, since 2018, has very much been that maintain services, look for ways that we can either generate income or make efficiency savings in ways that do not impact on frontline services as much as possible. I think this is a very balanced report. I think this is, and I said this in the briefing, one of the frustrations about this kind of thing is that we have to make our books balance, but at the other side, and this of course happens to us elsewhere, but one bit of the public sector is making our books balance, but then that will have an impact on increasing costs for other parts of the public sector. And that's an invidious situation, and indeed shows our broken health and social care system in terms of this is how it works, in that there is no, and we've been waiting for this plan. Local government and local NHS have been waiting for this plan for years, and been promised this plan for years from central government, and it just doesn't come. And again, time and again, local government of all parties are asking, can we have some kind of settlements? Can we have some kind of proper plan around this? And we keep not getting it. So in the end, it is an I'm all right, Jack situation. Well, of course, we're not all right because we're still under huge financial pressure. And we know our colleagues just next door in Isle of Wight, in Southampton and in Hampshire are in significantly worse straits than we are. And one of the reasons why we're able to keep it on this is because we've had a philosophy for a very long time about maintaining services and making sure that we can not do things that reduce services where at all possible as this administration. So I'm happy to approve this. I think one of the things to point out, and it was mentioned earlier in terms of delegated authority, this is something that we already do when we're setting fees and charges for the independent sector around that, and we took that decision some years ago. It's not a case of abrogating responsibility because it will always be the political side, us as political decision makers, including obviously at full council tomorrow, as this is part of the budget setting proposals from adult social care. But it is a case of we will always set those parameters. Any delegated responsibility we give is only within the parameters, and in our fees and charges it's always very specific. And thank you so much for Richard and Andy for the report, but specifically Richard and his team, who when we see our reports to do with finance are always very, very specific, very clear, gives them very clear guidelines that we are giving them in terms of setting these fees and charges. And it does seem that we're in this position now. It makes sense for us to do this in this way, set these parameters now so they can work efficiently into the future and give a lot of notice rather than having to wait until our budget comes through each year, that we can actually set it in a much more systematic way, which I know in terms of working with our residential and domestic care providers externally, in terms of what we as a council will pay, works a lot better because we can talk to them a lot earlier than we could when we were doing it in the old way, which was effectively coming around this time of year and then we were saying, oh yeah, this is what we're going to pay you. So it has improved those relationships and also certainty for our care providers. As we know, obviously they are also up against it in terms of finances, etc. And as much as possible, we don't want them to. We want as few of them to go out of business as possible. So I'm happy to approve the recommendations. I am not going to read them out at all. Oh, Brian, did you just want to comment?
Yeah. It's just going through it again. There's one that I ringed that I might have missed something, so if I have, I apologise. But page 9, 5.8, table 2. Yep. Can you explain the 28% increase? The 10% for nursing I accept, but 28% increase for residential. Can you just explain why that increase is so high?
Yeah, so this section
It does appear to be a very high increase, doesn't it? 28%.
Okay, so just rereading it to make sure I'm absolutely clear on that
As I say,
paragraph.
I might have missed something. So.
Okay, so this is looking at the section of in-house residential and the charges for city council clients. So yes, so this is, if you go back to, sorry, I'm just rereading the section to make sure I'm absolutely clear before I give you an incorrect answer, which I wouldn't want to do. So, yeah, so what we were looking at was the external market. That's right. So we were looking at, and table 1 first of all, if I explain table 1 and then move on to table 2, because I think I need to explain the section in detail. So table 1 shows the current weekly charge, and it also shows the current weekly cost of providing services. So if I look at residential as the first line, so the current weekly charge of £861 is what we currently charge clients before the financial assessment is undertaken. So some may pay that, some will pay up to their maximum assessed contribution. So not all clients pay that. The current weekly cost of providing those services, so i.e. the cost of running those services, is currently £1,337 per week. So you can see quite a differential. We then also, as part of this report, said we need to look at what would someone who couldn't access one of our in-house services and had to be placed in an external external provider in the care market, their current average cost of a placement is £1,022. So if someone was eligible and financially assessed to be a full cost client, i.e. they fully fund the cost of their care, then if they were in one of our in-house units, it would be £861. But if they couldn't be placed in one of those units and they had to go into an external provider in the care market, they would be paying £1,022. So what this report was seeking to do was seek to move towards a full cost recovery basis, but also provide some equity around clients who are in our in-house services or in our external services. So if I move on to table 2, which is your question, what we said was, based on that current weekly average cost, if we uplift it by the same rate that we would uplift we know we're going to uplift our external care provider rates, then the average, we think, next year would be 1,106. So we've taken the current average cost of placements for new clients at this point in time, uplifted it for the proposed market uplift rate that we would be paying our external providers to give us a new external market rate. So the difference between the current £861 that we set as our fee rates compared to that new external market rate would be the 28% increase. Does that make sense?
Yeah, it just seems a lot to me for any increase to be 28. it just seems a lot to me for any increase to be 28%. Are you saying that the 861 we probably didn't calculate high enough? It should have been higher for this year, or
So what we're saying is
which would explain it.
our previous rates were set at a point in time. What we've seen is a significant change in the cost in the external care market. And so we're trying to provide some equity between those clients that are in-house and external clients, but also recognising that our cost of delivering those services is already significantly higher as well. So we're seeking to try and bring the rates in line with the external market, but still recognising that we're setting a fee rate that is well below our current cost of providing those services. So we're not seeking the full cost recovery principles, and only those clients that are actually assessed as full cost clients, and it's a small minority of the in-house clients that are currently assessed as that, and that is where they have financial assets above the upper threshold Andy was talking about. Then only those clients would be asked to pay the full cost of that. The majority would either pay nil or some contribution towards it, not necessarily the full cost.
Thank you very much. But I've got to look forward, because a few years' time, you know where I might be. So, thank you.
Thanks, Brian. And I think it is it's a good question. It's a good point, because ostensibly it does look like a big rise, and it is. But it is about that. We have to do this to make sure that our finances can wash its face and we can protect services across the board. And as Richard and Andy have said, I mean, it's about that full cost recovery. People who've paid the full whack of their care, which again is because we have not been given, there is not a plan for how the care system is going to work from government, and that's what local government wants, and what local government has been asking for, and what local government has been promised since 2017. So we're now 7 years on, and we still have not got what we were promised. It's almost exactly 7 years ago now. I think it was March 2017 we were promised this, and we are still waiting for that, and we've been told it won't be until after the general election. It was punted down the road. So we have to do this because we have to make sure that we can protect services at the front line. We also have to do it in a way that makes sure those people who do pay the full cost aren't going to be depreciating their assets too quickly. If we made it full cost recovery, well, no sooner would they start paying that they'd suddenly they'd be depreciating their assets, and therefore we'd have to be paying for part of their care. So actually, we actually end up paying more. So I think this midpoint is the right way for us to make sure that we can provide services across adult social care, and indeed across the council, because remember, this is about the whole council in the end, about what service we can do, but also by making sure we're not overpricing out our residents who have to pay their full cost. And indeed making sure that there is that fairness between, because there was becoming such a big disparity between, if you're fortunate enough to have a space in our in-house units, one of our in-house units, and pay your fees, which are so much lower than, and it's luck of the draw, because you might really want to come into a Portsmouth City Council unit. It's full and you have to go somewhere else, and you're paying significantly more cost, and that's actually in a way that's it's a lottery then, and you're being quite inequitable towards a very small number of people, or rather a large number of people who can't access that. So as I was saying, I am happy. I'm not going to read out all the recommendations as they are very long, but I will read out, so I'll get up where it's a bit easy to read. But I will read out that I agree the following changes to the mechanism for setting the adult social care fees and charges for the financial year 2024-25, which obviously we've talked about, and obviously for anyone who wants to see, they're fully spelt out in the report and within the agenda for this meeting. Delegate authority, again, as we've discussed, which will be about adjusting the fees and charges in line with CPI at September last year. and then going forward delegate that authority within the significant, the tight strictures that have been set out in this report, which is in a similar way that we do for what we pay external providers for our services that we fund. And then agree that where it is proposed, and this is the important thing, where it's proposed to amend an existing fee or charge by an amount different to that calculated in accordance with recommendation C to that delegated authority, that the proposal is published within the Members' Information Service and advance the start of that. So that's a really important part, because that means that it's always open, transparent. Members' Information Service is available to all councillors, and therefore any councillor can call that in, and we can do that. So that is fully there. But I am happy with all those recommendations, and thank you everyone for your contributions today.